So starting with the artery side of the systemic vessels, as the aorta leaves the heart, it's the ascending aorta, then the aortic arch, then the thoracic aorta, and the abdominal aorta is going to be in the abdomen below the diaphragm. If we go back up to the aortic arch and talk about the exits that come off of it, that blood would reach first. The first exit is the brachiocephalic trunk, which comes behind here and then branches to the right common carotid artery and the right subclavian artery. The second exit off of the aortic arch in the middle is the left common carotid artery, which then goes up and branches to the internal carotid artery that I cannot see on this model and the external carotid artery right here. Then the third exit off the aortic arch is the left subclavian artery. This, number 12, is the vertebral artery, but I probably wouldn't ask it on this model because it doesn't really show it go up the spine in the back and you can't see the basilar artery at all. If I then come over to the venous side, this model shows the internal jugular vein on both sides but does not show the external jugular vein. And then the subclavian veins come in on both sides here. So where the jugular vein and the subclavian vein come together, this is the brachiocephalic vein on the left, this is the brachiocephalic vein on the right, and then where they join together is the superior vena cava. Going to the vessels of the arm, the upper limb, we have the right subclavian artery here, and then as it passes through the armpit, this is the axillary artery, and then in the arm, this is the brachial artery, and the brachial artery is going to branch to the radial artery and the ulnar artery in the forearm. On the venous side in the upper limb, we have the median antebrachial vein here, coming to the median cephalic and the median basilic veins branching. This is the cephalic vein going all the way at the lateral edge of the forearm and arm. This is the basilic vein going up the medial edge. So as the median antebrachial vein splits, this is going to be the median cephalic vein, and blood will flow to the cephalic vein next. And on this side will be the median basilic vein, and blood will flow into the basilic vein next. The brachial vein is really cut off, but it just shows the upper portion, and you can't see the radial or ulnar veins at all on this model. The axillary vein is where is the portion of the vein between where the basilic vein meets with the brachial vein. So from either of those, blood will flow next into the axillary vein, and then the cephalic vein comes in above the axillary vein, so blood would go next into the subclavian vein, and then we're back at the brachiocephalic vein and the superior vena cava back to the heart. In the abdomen, we have the abdominal aorta. The celiac trunk is the first exit off of the abdominal aorta, and it branches in three places. The left gastric vein, kind of in the middle, going vertical. The common hepatic vein going to the right to the bulk of the liver, and the splenic vein going off, or artery. Was I saying vein that whole time? Left gastric artery comes up vertical off the celiac trunk. Common hepatic artery going to the liver on the right side, and the splenic artery on the left side going over to the spleen. On the venous side, the splenic vein runs alongside the splenic artery. The left gastric vein is near the left gastric artery, and the hepatic portal vein is going to run alongside the common hepatic artery. Then the hepatic vein comes out of the top portion of the liver and goes directly into the inferior vena cava that goes back up into the heart. The second arterial exit off the abdominal aorta is the superior mesenteric artery, and the superior mesenteric vein is right here next to it, near it. These are the left and right renal arteries and veins coming out both sides, and down here is the inferior mesenteric artery. This model does not show the inferior mesenteric vein.